I know the kids are going to want to say that summer is still going on, and it will be for a little while longer, but all the moms and dads out there know the school year is right around the corner. So this morning, we are focusing on sleep for your kids. We have headed up to the Murmaid Mattress factory in Cleveland, checking in not yet with Roger Pickett, but with a friend of his. This is Brian Fretwell, a physician's assistant with Direct Primary Care Associates. Good to see you this morning.
Good to see you, Julie. Thanks for having me.
So here we are surrounded by all of these mattresses, a very important backdrop for our conversation because, as I understand it, today's generation, the young people, are the most sleep deprived we've ever seen. Is that right?
It is true. Most of what we see in our office, especially with adolescents right now, some derivative of some sleep-related illness. Things like insomnia, parainsomnias, restless leg, wakefulness in the middle of sleep when they should be sleeping.
I want to go back to your name. You are Direct Primary Care Associates. When you and I were chatting before the cameras began to roll, you said you can't overstate enough the importance of having a primary care physician because figuring out the cause of sleep issues is not always that easy.
Absolutely. Sleep issues actually can be primary or secondary causes. The one thing that's happened within our American society right now is people are more often pushed towards specialists and away from that primary care or family medicine setting. So we like folks to come in and see us first and let us diagnose the true cause of their insomnia or sleep disturbance.
When people are coming in and talking to you, I think probably one of the first things you have to do besides the clinical side is the human side. You got to talk to them, don't you, Brian, about what's going on in their life?
Absolutely. It's funny that you say that because oftentimes you get 5 to 7 minutes to sit and talk with someone and figure out the cause or root cause of where the issue is coming from. We take a little bit different approach than that. We spend a lot of time with our patients trying to figure out the true root cause. And sometimes when people come into the doctor's office, they're just scared. And so we don't get a full and complete medical history. And that's one of the things that your primary care provider does, is really set that edge, if you will, in getting to know their patients so we can get to the root cause of the problem.
The timing of our conversation is perfect because it's the tail end of July. The school bells won't ring until the first couple of weeks of August, for some kids a little bit later. There's time for parents to begin to kind of readjust those sleeping schedules. When we're talking about kids, even teenagers and soon-to-be college students, how important is routine?
Schedule is actually the cornerstone of treatment. There's a couple of things that we do to primarily help sleep-related issues. Diet, exercise, limit caffeine, and the hallmark is a proper sleep schedule. And that's time to go to sleep and time to wake up too. And staying on that schedule and staying on that routine is primary treatment.
One of the reasons that we are talking today, the folks at Volunteer Behavioral Health, who you'll hear from in a little bit, see this in their work every day. They wanted to raise awareness of the fact that it's not just the fact that your kids might fall asleep taking a test. There's a direct correlation, isn't there, between sleep deprivation and mental health issues, which we hear about all the time.
Absolutely, and that's really what I was talking about as far as primary and secondary causes. Primary cause of insomnia just being I can't go to sleep, I can't stay asleep, I can't have a restful sleep being one, and number two being a secondary cause of depression, anxiety, and other mental health disorders. Again, the cornerstone of treatment of that is behavior therapy.
I know you didn't really want to come here and get people driving into your practice, but there might be some people thinking, wait a minute, I've not heard of them before, or this is new to me. You do have 4 different locations, 2 of them within our area, right?
Right. We have Dalton, Georgia, here in Cleveland, Tennessee, Athens, Tennessee, and Knoxville as well.
You do see pretty much the whole family, 2 years old and up.
Absolutely.
When parents come in, do you see each child at a time, or do you sometimes kind of talk as a group to them to find out what's going on?
At Direct Primary Care Associates, we do things a lot differently. We only see one person at a time, but we see families, we see groups of people, and that's who we really want to see. We do not take appointments per se. We don't double book. Your appointment time is your appointment time. So we spend as much time as we need on each individual person. We take about 30 to 60 minutes per patient.
I know it's kind of that new approach, which is catching on quickly, of kind of the concierge medicine. You pay one fee, but you're covered for the whole month.
Yeah, the difference with direct primary care associates and the concierge medicine is when people think concierge medicine, they think, oh, that's expensive. You know, the two big barriers to healthcare right now are affordability or cost and accessibility. And we address those two issues by being very cost effective, low price point. We do not take insurance. And accessibility. We only see one person at a time, and we let our patients pick the time that they want to see us and how long they want with us.
You are a physician's assistant.
Yes.
I'm guessing that you got into the role of medicine because you did want to not only help people, but connect with them.
Absolutely.
Do you build over time? Is your hope to build these bonds, especially with young people who might be in a position where they don't want to always tell their parents everything, but you can be a safe person to kind of counsel with?
Absolutely. Trust is a key component to an outcome of any health condition. It doesn't matter what it is, because you can go to the best clinician in the world, right? But if you don't connect with them on a personal level, if you don't trust the things that they say, and if you don't trust the opinions and the advice that they give, you're probably not going to have a good outcome. So yes, absolutely, the relationship is key to outcomes in healthcare.
Everybody wants a successful school year. I know that all the parents watching certainly do, no matter how old their kids are. But no matter how old you are watching today, you still might be struggling with some sleep issues, and you might see it affecting your overall life abilities at the moment. So here's the information for how you can get in touch with Brian and his team at Direct Primary Care Associates. But after the break, we're going to check in with some folks from Volunteer Behavioral Health about what they're seeing in the mental health world and this real epidemic of sleep deprivation. Thanks so much.
Thank you, Julie.